What comes to mind when you hear the words hyperuricemia and gout? Identified as a medical disease well over 3,000 years ago, gout has a rich history that has developed over the years, not all of it accurate. In this video, we will learn more about hyperuricemia and gout. Gout is a form of arthritis, and arthritis is the general term given to inflammation of the joints. Inflammation is what happens when a substance stimulates white blood cells to try to remove it. In the case of gout, the substance is uric acid. We all have a chemical called uric acid in our blood. It is produced when cells die and are broken down, and accounts for more than 75% of the uric acid in our bodies. This happens all the time as part of the life cycle of cells and also occurs during injury, surgery, and chemotherapy. Some of the uric acid in our blood, about 25%, comes from the food we eat. Foods with a high purine content, such as shellfish and organ meat, increase uric acid levels. Everyone has some uric acid in their blood, but some people have much more than is typical. Their body may make too much, or their kidneys may not be able to filter out enough from the bloodstream. People who have too much uric acid in their blood are said to have hyperuricemia. If you have a blood test to check your uric acid levels, you will get a number that is usually expressed in milligrams per deciliter. Ideally, your number will be between 3 and 5.5. A level below 6 is considered safe. If the uric acid concentration in your blood reaches 6.8 milligrams per deciliter, the molecules can come together to form needle-shaped crystals. Your body is threatened by these crystals and can launch inflammation to try to remove them. This immune response, which is designed to protect you, will create inflammation in the form of pain, swelling, and redness. This is called an acute gout attack and often comes on late at night or early in the morning. It can last from a few days to a few weeks. Just so you know, it is the inflammation that causes pain. You are not being damaged by the crystals themselves. Not everyone who has hyperuricemia experiences gout attacks. We don't know why, but it is important to understand what this means. A gout flare alerts you to the fact that you are hyperuricemic, but you would otherwise not know this without a blood test. There are studies that indicate that living with hyperuricemia has negative health consequences. Uric acid crystals gather in your joints, such as the one in the base of your big toe, your fingers, elbows, and knees. Crystals can also gather in your kidneys and other parts of the urinary tract, and this is obviously not a good thing. It is important to understand that crystal formation happens because your uric acid levels are too high. Even after an inflammatory attack has passed and you no longer experience pain, the crystals are still there and will continue to accumulate. If you have gout, you are not alone. About 4% of adults in the United States, over 8.3 million people, suffer from gout. Both men and women get the disease, but in women, symptoms typically appear only after menopause. Most people with gout have the disease because of genetic factors. It is not their fault. However, there are factors that increase the odds of developing hyperuricemia and gout, such as chronic kidney disease, high blood pressure, having a body mass index above 30, experiencing frequent dehydration, overeating on a regular basis, especially eating large amounts of meat, shellfish, and organ meat, drinking excessive amounts of alcohol, drinking sodas containing high fructose corn syrup, and taking medication such as diuretics and aspirin that affect your uric acid levels. A diagnosis of gout usually consists of 3 parts. 1, the inflamed joint is examined. 2, a sample of the fluid within that joint is taken and inspected for uric acid crystals. After the flare has disappeared, a blood test will be taken to measure how much uric acid is in the blood. There are several effective medications that will help to calm the inflammation and pain associated with a flare. It is important to remember that these medications, although effective at dealing with the flare, do not address its cause, the hyperuricemia. Earlier we mentioned that only about a quarter of the uric acid in the body comes from the food you eat. A healthy, low purine diet is good for your overall health, but to truly lower your uric acid levels, you will need medication, and there are several very effective ones. Some will reduce the amount of uric acid excreted by the kidneys. Some will decrease the amount of uric acid produced in the first place. A relatively new medicine will break down uric acid into allantoin, which is not dangerous for your body and is easily excreted by your kidneys. Because these medicines reduce the amount of uric acid in your body, the crumbling acid deposits can trigger an inflammatory response, which will result in a flare. This is painful, but it's part of the healing process. Know that you are on the right path, and once your uric acid levels come down, the flares should eventually stop. Hopefully you now have a better understanding of hyperuricemia and gout. You know that caring for your body and taking the right medications will help you successfully manage this disease.